Yat shikeda shidene ada hana that so gizido that is not sai. Kodotara hodzando hana hasilti. Like to welcome all our listeners. Thank you for tuning in to our weekly town hall. It is Tuesday, April 5th. So we're going to provide some updates. We got some professionals that will be providing some updates, and then also within our leadership. Again, welcome to our town hall. So without further ado, we like to open up in prayer. So we'll go ahead and pray, and I'll go ahead and conduct the prayer in my own native language. Kudehojondole, Shamana Hastan Yadilhil, Zislistan Twistan, Adochal here. Ayol Kasna de Tsui, Hash Elti Hash Ewan. Sa Antradin Ani sa Anarabik Ahojon. Ni Yajin away ni Glon Conti Binibi in Tsanadilzen. Ado Hashin Sokotan Faden Con. Hata as Gizdo da Isai, Edo Ashwan Londo Le. Nza de Shin da Kre, Ado la Shin da Nish, da Oltra Howadeda. Nahaz Tani, Nakabashwan Londo Anil Tron. Con hata as Gizido Hanet, which Nane Nehikon, Yikit E Trando Le. Ado Yidisendo Le, Nasgo Ape, Benantin Nahotlondo Le. Ado kon hinat an lini but na desendole. Hinat an lini do hon a large ekedo dasadani. Ado kon hi chief of staff deputy chief dolie. Ado etalate nat anik ebedak eit a kon da istai. Ado na khadel nishiki do hashin sakotindal nishin lini ho wat dot nat ani dahalla. Amma ajja amma san enale. Ado amayaji keta ake alto. El khaije da danle ado as tuisani til KJK. Yat hon basnata hastando le. Ado hon hi besh mahasa anentrat nas nile daladle. Tinheshji be da bet orjini not ani. Yat hon nada kedole. Njuno kompen sakes ezolo insen. Benahat a digino insen. Ishi nasku ye ina ilahi dinsendo. Aro kon ye sitin zini. Njunon hiknahot at ole konti dene belkahot zabaka it nane darole. Hashin zagon hachinin hitoken hinaliken zaden da kri. Edo kodoya at da kridole do. Ha ishi kachana den zini hombelek et hasya dole nanish ultra adan lekon. Aaron hits a lot so a quidje benelni. Do ya at kon. Ni hilna da hotlon le has queen hizani. Aro asa ani zino. Yi dasete. Ni hi konta de klidon hi honish gishnas trade. Aaron hit hotnas kane and hits it skenas lade. Ni hinas gloshin de benashni dole ni keyatan leni kon. Ya at hilna ho at dole. Aro de ishi nar doi. Jo kosto jo pa inalto hits adolto adi e ya at kon hit na hoito what ho pa na ini kan hits so de zen niki yin da di yin dole ashi ene at ni o tlatnas lande o jobe da hi dil so dobe da hi de nilsen on ha insen dole shamana hasan ya de hil ha ishin belah isla dobo o isla benena hos ni dole Ado hon chianchi ini trochil ini ben hitrayata hot dole. Ni masanin hitcheli edan lini is el edenas daniho. Betrayanta hon. Slatat ayat das jon hitcheta has kedole. Ado kon halchini to kes twisani awalia de nas dani shon dani zion hitcheta isni dole. Ni hit a lot so bet hon dole hade shin hitchanta kre. Nila bin hi keben etas London yat da kedole. Ado khashine la kon nas twin hizani ni edan lini bejetastel edon da niskas. Yat inan lini hoich nada on ha insendole. But it is in Lini Behanana seat ole. Did it ben hit Wajanasli, 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 Wajanasli. Ikke ha, Chick Ado Shidne, Kodo Eya, Wadinosan, Kodo Dashis not Kodo Tsuna Hodezi, Eshi Be not Edole. Again, I'd like to welcome everybody to our town hall. And just to provide a brief update, again, my name is Perfilia Fowler. I am the Division Director, Division of Human Resources. I'd like to acknowledge all our leadership, our frontline workers, and our deepest condolences to all the individuals who lost loved ones. It is time to heal. We're in the healing stages. I know it can take a while, but we want you to continue to stay strong. We did come across our COVID-19. We talked about many variants that have came about. We have the vaccine. We got boosters. We ask that you kindly request that you get your vaccine. We want you to continue taking precautionary measures as much as possible. Our mask is still a mandate. We will listen to hear from our health professions as well. Kodoshen ochadas anako ikihet nan hidini do le shady my deshkisning shlon to the chain bashin kapaha edashichegot asche dashanale fotos aholiena ane yisunasha aro kanat ani ta is idonat ani dan linikon ihebedi ni dole halot abi tadidi ka edo dani zanoko benit soit a e kodo banahui nito be nature Aro hashine la e kwaan na has twin hizani to keji keda dan loho ni hits up ke da hastin. O konde hashto it aro leshik edo shidne yego vich ka inos no edosne sa ya at ehibe che edalti yo on ne ya at ehibe che edalti. Aro hashine la kon khandal nishi salah des ade Aron da alkahadan lina it's isne jahida. Jo e hashin zei in dan lido ze ne kahada dan ne. E shin lo kodo hihe bedin ni dole. O huni you are ni besi ke. Aro jenna wal yeni yini wal yeni yin hinne. Dosto tzit e da lahon da kosin sanas e ata bedin nini. Aro saho inda wal ni jo e very isne. Ado ze bahazli di no kodo behanetse. Ado booster del yenida ze nha dalne dan hit no ta kodo ze ich in yen hit dalne. Ado di an hit chinton hize tada des bal at anda kain hit anda chigata di nini. Nihila da khanda gestra eot a kodona antin lini nihit johanan net ole ado behes ani Achanada hin dehido at echa inal kidigi to ekodo ba nahanin dole. Dishe ekodo Department of Personnel Management who ya on asata do asa kun asata najit oje e da inish ko ndas nashin hido hihe hidini dole hihe nakate nos nish aro yego dat da hosnia Aron hinago be eta hanosen Sadia at ebe che adat hit a e kodo be adole shik edo shitne. A cook a chedi hinat ani lini, which we net or less ado eshi sen hichahatot ado ze is in it and lini kodo but al ketna dastzo. But at this time, I'd like to welcome our President Jonathan Nez, who will provide us an update, and then we'll move forward to our Dr. Jill Jim and Captain Brian Johnson. President Nez, thank you for joining us. You have
All right. Thank you, Dr. Fowler. I just got in on time. I spoke at a division at the Division of Social Services employee recognition, just letting them know that we appreciate the hard work that they have done. Many of them are getting their 5-year, 10, 15, 20, 25, 30 plus year awards for their service. So we thank the Division of Social Services for their hard work. And so thank you for joining us today on the weekly town hall. I know that the interest in watching may be diminishing because of the low numbers that we have been experiencing lately. But thank God that we're seeing some very, very low COVID-19 rates here on Navajo, as well as, thank God for the death rates being low. Of course, one is way too many. Our thoughts and prayers go out to our families throughout the Navajo Nation, all across the country. And to give you an update, we'll go with the first slide, and just an update. I know people tend to say, wow, that's the same old information. It's not. It just gives you an update so that you are aware of what's happening here on the Navajo Nation in terms of numbers. Data is very important to us, but yesterday, 4 new cases with 0 deaths. Total confirmed deaths thus far, 1,734. Let's continue to pray for those families who lost loved ones. And also, again, pray for those that have some long-term health problems from catching the virus. Slide 2 gives you a overview of the past 14 days. The blue line is the COVID positive cases per day, and the yellow-orange line is that the death rates. You can see a significant number March 26, 27, 28, 29. And let me just let you all know, and I mentioned this a few weeks ago, that reporting is now, for a lot of states, once a week. Here on Navajo, we still do 5 times a week. We don't do weekends anymore because those data that we receive from the states don't come in on the weekends. So we have nothing to report on the weekends. So that's why we hold off until midweek. And reconciliations do occur, meaning that we find out that maybe one of our Navajo citizens lost their life off the Navajo Nation. And that number finally comes trickling in through the state departments and reported back to the Navajo Nation. So when they do an audit or a reconciliation, there's a bump in cases or a bump in death numbers. So that contributed to the high numbers, 28 and 16 and 9. And we're back to being up to date. We think the State Department of Health for New Mexico, Arizona, and Utah, I know they're doing their very best there. The healthcare facility staff are transitioning back to regular operation. So sometimes the data gathering, the reporting does take a while. We've been in this pandemic for 2 years now. A lot of operations, procedures had to be put on pause. And now they're starting to get back to doing operations as well. So I appreciate your patience. We need to get those procedures done. And of course, we appreciate the awesome work of our healthcare professionals all across the Navajo Nation, across the United States. So I just wanted to explain that to you. I know that's delayed in reporting sometimes. What does that mean? That just means that, when we see numbers, Navajos are everywhere, that, all over the country. So some of those numbers come trickling back in. And we have to make sure that those that we're counting are the ones that are actually living on the Navajo Nation. Some may have been sent to other healthcare facilities further away. So that is the reason for the delayed count. So the third slide just shows you a view of what we've gone through for these past over 2 years. 1, 2, 3, 4 surges. And we're at a low number now. Excuse me. And so we just ask that you stay the course. Stay the course. Wear your mask, Some of these functions now, events, meetings, before you go into a meeting, they either tell you to get your COVID test before you go in, or they ask you for a vaccination card. if you're not vaccinated, you don't want to get vaccinated, then you have to show a negative test result. And so I know some of you kind of say, well, he's not wearing his mask at these events, especially in DC. We have to go through those strict protocols, just to let you know. And they are very strict on those protocols. And, everybody in there is COVID negative. And so I think that's going to be the future, really, ladies and gentlemen. Here on the Navajo Nation, you may have to start showing your vaccination card or take a COVID test. They only take 15 minutes before you go into a larger event, just to keep everybody safe. I know it's going to be time consuming, but hey, we want our elders, our most vulnerable population, to be safe here, because this COVID-19 is not going away anytime soon. There's a new Omicron variant that is on the other side of the world. It's starting to creep into the United States. We're monitoring that. But thank God, if you go to the next slide, thank God that we are a large population that is vaccinated. As you see there, the vaccination percentage, 75.5% fully vaccinated, 1 and 2 shots. Booster shots, they're the 3rd shot, and then the 4th shot is available too to those most vulnerable population individual that are in the most vulnerable population category. But the 3rd booster shots were over 50%. Some of them, they're not able to get their booster because they're not within the 6 months, and so that's why there's a low percentage. But it'll start going up high as we go into the summer season, spring season, summer season. So as you look at the age category, 5 to 11-year-olds, 45%. That age category was recently approved for vaccination. That was the reason why it's a low percentage. Now, if you go to 12, 19-year-olds, 74%. Good job for the young students there. I think they really want to go back to school and they want to get vaccinated and be safe. Parents, thank you so much for getting your children vaccinated. And 20 to 24-year-olds old, we need to step it up, 58%, get fully vaccinated. And same with the 25 to 14. But if you go 45 to 64, 84% fully vaccinated. Look at our elders, 65 and over, 89% fully vaccinated. So thank you so much for making that a priority. I know we are not out of the pandemic yet, so please stay the course, follow the guidelines. Masks are still required here on the Navajo Nation, and we are now announcing today, and Dr. Jill Jim and others will be talking about the public health emergency orders that have been put in place. We are now in yellow status. The next status is green, so let's keep doing what we're doing to get to green status. Yellow status means schools and businesses, 75% occupancy, okay? Again, the mask mandate stays, and we also are going to be announcing today the guidelines for graduations. We're going to have graduations this year, but we're going to do it safely on these COVID protocols. Guess what? We're going to also be doing fair and parades. There's going to be guidelines for that. You might have to show your vaccination cards at these larger events, but we will be having fairs and parades. But we'll be monitoring it. If for some reason the variant ends up taking off again here on Navajo, of course that'll all go away. But right now it's looking favorable that we'll be having fairs and parades here on the Navajo Nation. Of course, parades doesn't mean we're going to be throwing stuff out, or how I used to do it, run around and shake everybody's hand. I think that's not going to happen this year because of some of the guidelines that are put in place. Gyms and wellness centers are going to be reopening, ladies and gentlemen, at 25% though. But gyms and wellness centers are going to be reopened. Outside events will continue, but they'll be a little larger groups. But we appreciate the Navajo Department of Health for giving us the green light, gyms and wellness centers, so that we can begin to strengthen our immune system for the next flu season, right? And to push back on COVID-19. The 1 million masks that we've received from FEMA are almost out. The last update I got from Oliver Arviso is that those masks are at the chapter houses. If you need masks, please contact your chapter. They have KN95s, N95 mask out there for you all. And we handed out some at some of the events that we were a part of these past couple of months. So keep those masks on, everybody. Last week we were in DC visiting our congressional delegation. They all know, ladies and gentlemen, that you Navajo people have done an extraordinary job in pushing back on this virus. That's all I heard from our congressional delegation. Good job, Navajo people. Now I want you to know that, because Navajo is a model throughout this country, maybe even throughout the world, of how we can be a high vaccinated area and not have that many people end up in the hospital, and to keep everybody safe because of these very strict protocols that we put in place, ladies and gentlemen. I know some people were like, masks don't work, vaccinations don't work, lockdowns don't work. You know, look at the data. This shows that those protocols do work. And thank you, Navajo people, for following those protocols. And that is the reason why we are a example of how if a region in the world takes very strict protocols and gets vaccination rates very high, how the death rate is lessened and the hospital visits lessened in a region. I just want to mention we visited Senator Mark Kelly, Representative Ruben Gallego, Senator John Tester, Chairman Representative Mark Tucano, Representative Ann Kirkpatrick, was great to see her, Representative John Curtis, Senator Ben Ray Lujan, Representative Tom O'Halloran, Representative Greg Stanton, Representative Melanie Stansberry, Senator Martin Heinrich, and Chairman Representative Rahul Grijalva, Representative Debbie Lesko, Representative Yvette Harrell. And we also met with some of the secretaries, the cabinet of the Biden-Harris administration. We met with Secretary Deb Haaland, the FEMA administrator as well, Deanne Criswell, also Secretary Pete Buttigieg, U.S. Department of Transportation. And we were at the White House just giving them updates about COVID-19. We are in the process of requesting for additional COVID-19 test kits. You know, some of you may have noticed that there was the free test kits that were being given out. If one person in your family uses the PO box number, the second person using the same box number will not be able to get those free test kits. And we told the White House that multiple families sometimes use one PO box, and it's not fair. So we told them, give it to us so we can give it to our Navajo citizens. So that's still pending. We'll see what happens from the White House. But we appreciate all our leaders. You know, they're the ones who helped us with COVID-19 relief, the CARES Act, ARPA Act, infrastructure. On behalf of the Navajo people, we said thank you to helping us with these infrastructure dollars. And those of you that got the hardship funds, I know not everybody, they're still printing checks. There's 404,000 enrolled citizens, a lot of Navajos, and they haven't printed all the checks out yet. So appreciate your patience. It's getting there. Many people have received it, utilize it for, relief and even preparing for the future, ladies and gentlemen. But we did say thank you to the White House, the Biden-Harris administration for the hard work in helping the Navajo people. So I'm going to say all this in English. I want to make sure that Dr. Jill Jim and Captain Johnson get a chance to give their updates, especially with the 3 new public health emergency orders that are going to be issued today. And if you could translate for me into the Navajo language for elders, I appreciate that. So thank you so much. I'm going to turn the time over to Dr. Jill Jim, Executive Director for the Navajo Department of Health, who's doing this outstanding job here on the Navajo Nation with Rosalind So, Captain Johnson, and our 638 facility. Everyone doing a great job in monitoring the COVID-19 and also giving resources and helping our Navajo people. So Dr. Jill Jim, take it away. Thank you.
Thank you, President Ikehat, for providing some updates regarding the COVID-19. I'm just going to repeat a lot of stuff that President shared. So to those that are listening, I'm the Executive Director for Navajo Department of Health, and I just want to thank everyone for being on the call. And also just knowing that we are seeing a decrease in numbers, we just want to make sure that we continue to stay vigilant. So you'll see here on the PowerPoint, as President mentioned, as of today, this morning, businesses can now operate at 75%. You'll see all the lists and have a specific guideline. You'll also find the public health orders on the Navajo Department of Health webpage. Personal care services used to be appointment-based only. They're no longer need an appointment for that. And then also flea markets can continue to operate following protocols, 25 persons for youth programs. And as President mentioned, gyms, wellness centers, and recreation centers are now open at 25%. For public health order number 5, we're just wanting to reemphasize safer at home, but you're not restricted to stay home, as so we're seeing cases here on the Navajo Nation as well. And mainly we updated our gathering limits to 25 or fewer for social gatherings, traditional ceremonies, churches, youth programs, and holiday gatherings. All will have updated guidelines this week as well. So just look forward to those updated guidelines on the Department of Health webpage. In addition to that, we'll also have the gathering limit for in-person meeting and trainings remain to be 25. And then we've also increased the gathering limit for outdoors to 50 or fewer. And then also for those events, we're encouraging event administrators to look at vaccine verification, and drive-up gatherings are now 100 vehicles or more. For the public health emergency 5, we're looking at the graduations, and so we'll continue to monitor if the numbers continue to decrease or not. There's levels for low-risk graduation events, there's moderate-risk graduation events, and there's high-risk graduation events, but indoor in-person events are allowed and then do have occupancy limits and also time restrictions as well. The second one is just fair events are allowed at 50% for indoor and then 75% for outdoor seating areas. And we encourage fair event administrators to also look at vaccine verification. As President said, the last public health order is number 6, putting the schools at yellow, increasing their from 15 to 25 for non-classroom instruction or other community activities, and allowing sports attendance for 50%, which was already allowed, but addressing the outdoor seating areas now that we have some spring activities for schools, and we just continue to encourage students and visitors to stay at home, and then also to report any exposures to the Navajo Department of Health webpage. So just wanted to share that with everyone this morning. I know that Captain Johnson will have some updates regarding health facilities, but everyone just needs to stay vigilant and also continue to practice 3 W's, wearing your mask, watching your distance, and washing your hands. So Thank you very much for listening, and I'll hand it over to Captain Johnson with the Navajo Area Office. Take it away.
Okay, thank you, Dr. Jim. We certainly appreciate the continuing conversation on COVID-19. I think as President Nez indicated earlier, it's possibly losing some interest because we know the numbers have gone down over a period of time, but it still remains certainly an important issue here on Navajo that we need to really be monitoring closely. So I just want to say thank you to everyone. This is Captain Brian Johnson. I serve as the Acting Deputy Area Director for the Navajo Area Indian Health Service. I work beside Miss Rosalind So here at Area Office in St. Michael's, Arizona. Just want to give a shout out to all Navajo land across the Navajo Nation. Certainly appreciate our partnership and our work together over the many months of the pandemic. And although we would like to say the pandemic is over, we would like to say that. We know that technically we continue to experience cases. So although the case numbers are low, which is a good thing, that's a really good thing. Also, you know, as an indicator of that, we know, as I believe President Nez touched on as well, that we're presently in the code, the yellow color in terms of the pandemic, and hopefully we'll get to that next step, which will be the green status, and certainly we look forward to that. It's kind of a refreshing time of the year because, of course, we're in the spring months, and the weather is really beautiful. And it's really nice to know that our cases are low. We have beautiful weather. There's plenty of options for activities outdoors. Taking maybe some time to really enjoy nature and getting out there and getting some exercise. And as was indicated earlier in this broadcast, it was mentioned that the fitness centers and the exercising facilities, there will be some opening. And that, too, is a promising thing. So lots of positive things going on that we're certainly looking forward to, and as we head into from spring into summer. And hopefully we won't see another spike in cases, but we know that we have to remain vigilant, of course, towards that end. And we also know that the mask mandate here on Navajo Nation continues, and we certainly respect that decision. And I know for our staff across the Navajo area, working with the Indian Health Service, that we continue to share that message, and it is important. You know, I was talking recently with one of our clinicians who pointed out that, you know, we know our COVID cases are low presently, but we also know that we are seeing a few influenza cases here on Navajo, which, you know, if we think about it, when we talk about the mask mandate, it's just basically we get two good things out of wearing our mask for the time being, which includes certainly preventing COVID, and also hopefully avoiding and preventing the transmission of influenza. We want to make sure those numbers stay down as well. So certainly don't want to forget about that. So across Navajo area, I always like to just mention to the listeners that in terms of the Indian Health Service, we continue to certainly work with the Navajo Nation, with the Health Command Operations Center there in Window Rock. And we continue to work and speak with our state colleagues and our local public health officials just to continue making sure that we're understanding what's going on in terms of COVID-19 around the Navajo Nation. Again, we know that the cases are low, but there's some reasons behind that. Some of those reasons include the fact that the Navajo population has done a tremendous job in following the prevention strategies that have been talked about over the last two plus years. And we thank you for your efforts because they have paid off. We're certainly able to enjoy getting a little bit more freedom in terms of what we're doing, where we're going, And again, we know the mask mandate stays in place, but this is all a reflection of the hard work that's been put into it by the Navajo people, and we certainly appreciate everyone for that. Again, we know that Native American populations have been hit hardest by the COVID pandemic, and a lot of times we have a number of different statistics which show that Native Americans continue to be at increased risk, 3.5, 4 times even higher than that than others in the country. And so with that knowledge, we know that if we really take time to protect ourselves, we can reduce that what we refer to as a disparity, the difference in that level, and certainly protect our people here at home. And so again, very important that we all work together and continue to work together. And we always talk about the word remaining vigilant, and we need to remain steadfast. We need to really be monitoring our environment. While we do and are able to enjoy the outdoor environments, while we're able to go back to our offices and taking special precautions, we also just need to make sure that we're monitoring our environment, the places we go, and looking at the data as any new data come out, so that if we start seeing an increase in cases, we can certainly move quickly to catch those and to do proper isolation procedures, and hopefully prevent unnecessary transmission of the virus again. And as has been discussed, there's lots of folks around the country, whether it be locally or nationally or even internationally, monitoring the various variants of COVID-19. And we know that in certain parts of the world that cases do increase, and so we have to really pay attention to those to understand what's going on in that region of the world, because that can quickly end up in our region, and we want to make sure we're following and doing the things that are right to protect those to the extent we can. Also, just wanted to mention that locally, while our cases are reduced and lower, and hopefully they'll stay that way, we know that with our health facilities across the Navajo area, whether they be Indian Health Service managed or Tribal Health Organization managed, we know that there's a transition that has been taking place as the cases started coming down and started coming down to an acceptable level, if you will. Our facilities started taking measures to make sure we're doing things internally within the facilities to make sure, as patients started coming back in larger numbers, that internal to our facilities, we're taking infection control procedures seriously, and we're doing what we can to protect you while visiting our facilities. And so this transition going from a major focus on COVID-19 cases, going back to what we refer to our regular scheduling that we had before COVID ever made it here to the Navajo Nation. And so we're talking about our preventative appointments, preventative medicine appointments, primary care, and we're talking about our elective procedures, making sure that those items that were not dealt with or taken care of or could not be during COVID when the case numbers were high, now we're getting people back in, and it'll take us a while. We know that we have a backlog of elective procedures, those types of things. Again, that was done for the safety and security of our patients, and making sure our facilities were not a source of transmission to the community. So it's a very positive thing that we're continue to transition back into the elective appointments, elective procedures, and we're just happy to provide those services to the patient population. In addition to those items, we're also you may when you read about COVID-19 and the experiences across the world, one of the things that you'll note, if you haven't already, is that there are post-COVID issues that perhaps were not here previously. And so we also know that you'll hear a phrase referred to as long haulers. And when you hear that phrase, what that refers to is COVID-19 patients, individuals who were infected with COVID-19, and basically now they have some type of health impact from COVID-19 that's not something that's just going away with the infection, but it's something that carries on for a while. It could be well into the future. So it's important that the individuals who are experiencing long hauler type health impacts, that we are concerned with them and about them, and that we're doing what we can to provide any type of special services that might be needed for those patients. So again, you'll hear that terminology used, and we'll continue to work towards that front in how we treat and handle and manage those patients to make sure that we get them back to health to the fullest extent possible, though they may experience some chronic long-haul conditions as a result of COVID-19. So, you know, I wanted to also just go back for a moment, again, because I feel like oftentimes we may forget some of the health conditions or the symptoms that one might feel with COVID-19. And though our symptoms are certainly fewer at this point in time, it's always important to remember, okay, what does it look like or what does it sound like when I have COVID-19? Well, it has fever or chills. It can have a cough. Certainly, sometimes it's a very persistent cough, shortness of breath or difficulty breathing. You can be quite fatigued. It just makes one feel very tired, much more so than normal. There can be muscle and body aches associated with it. Headaches are very common with COVID-19 infections. And of course, we've all heard likely about the loss of taste or smell. Sore throat, we hear that routinely. Congestion and runny nose, nausea and vomiting, and diarrhea. Any of these symptoms in combination with each other can be symptoms of COVID-19. So if you feel that by chance you start having these types of symptoms, or maybe a combination of these symptoms, that would be certainly a signal where you could reach out to your local health facility and just simply ask to get a test, a COVID-19 test. And I think that leads me into the next piece here. Our facilities do continue to test for COVID-19. If you feel that, again, that you may have some symptoms, or you feel that you were exposed to possibly a person with active COVID-19, then you can definitely contact your local health facility and you can get tested. That's still not a problem. We do want to continue those measures to make sure we understand what's happening in our community and to help patients get the assistance they need in order to address the virus. Also, just wanted to reassure the public and remind the public, while we've seen some great numbers here on Navajo Nation in terms of Navajo Nation residents and vaccinations, as well as not only the primary doses of the vaccine that can be provided, but also the booster shots. And just want to remind folks that, and again, reassure folks that we continue to provide these services. Just because the numbers have come down does not mean that we're no longer providing the vaccines or anything along those lines. We do continue to keep those in inventory. We continue to monitor those, how much supply we have. We continue to order as needed. And certainly your local health facility can continue to help with that. Should it be time for you to get a booster shot, or should maybe it be the first time that you're getting your primary series of the vaccine? Again, we are there. We're there to serve you, and certainly invite you to come to our facilities, make contact with us, and we'll do what we can to support our patient population. Again, when we talk about COVID-19, we shouldn't just dismiss the fact that influenza is still around. Normally, this time of year signals the end of the influenza season. However, given some of the issues with COVID-19 and given the issues where we can have fluctuating influenza seasons, we still do recommend that folks be careful out in the community should someone be displaying symptoms consistent with influenza. And again, as I mentioned earlier, the mask mandate is just another positive spin for anyone that may be exposed to influenza. It can be helpful in avoiding getting the infection. So that's just a bonus out of the mask mandate. So we are keeping an eye on the influenza cases here on Navajo Nation, and would certainly report here if we see a significant uptick. But we all should be aware that there is some activity on the nation, but it's not a tremendous amount of activity at this point in time, thankfully. And so we're very happy about that. So just wanted to, in closing out here, just wanted to state that, again, it's really great that our cases are low in terms of COVID-19. We want to hopefully keep them there. And again, by doing the preventive actions that you're doing, I feel confident that we'll be able to maintain that. There's lots of questions about from the public about, will we have another wave of COVID-19? And the answer is, we'll need to monitor closely. That's the best thing we can do, is really monitor through our public health and data management processes, and certainly make sure the public is aware if we do see some upticks going on, and which we will do. So just wanted to make sure that folks understood that. Again, we continue to advocate and encourage you and your family, if you haven't done so already, to get your COVID-19 vaccinations. We've done a great job here on Navajo, been really tracking those numbers closely. But we still have some improvements that we can make. Although the public has responded extremely well, we can always do just a little bit better in terms of our vaccination numbers. Again, mask mandate stays in place, so continue to wear that. I highly encourage that folks really continue to focus on hand washing, whether it be at your home, whether it be at work or other locations. Whenever we shake hands, whenever we are touching doorknobs and faucets and other areas in public, very important to continue that hand washing to keep any infections from happening. And again, just want to say thank you to not only the Navajo people, but everyone who has worked during this pandemic, from the housekeepers that are taking care of our health facilities, to the engineers who have been maintaining them and providing high efficiency particulate air filters, HEPA air filters, and those kind of things, all the way up to the leadership teams, and certainly on the clinical side, the doctors, the nurses, the various mid-level providers. It's really been an outstanding response in a difficult situation. And of course, all of our public health leaders who have helped with this. So with that being said, I wish everybody a great Tuesday and the remainder of the week, and I hope you and your family are well. And I'm going to at this time turn it back to, I believe we're going to go to Miss Larissa Cruz, and she's going to provide a presentation on the data, I believe. So Miss Cruz, if you're ready, I'll turn it to you.
Thank you, Captain Johnson. Yes, let me go ahead and share my screen, and I will present our most recent gating measures on behalf of Mr. DeLiazzi, who normally is the one who attends these calls. So this is the updates for March 18th through the 31st. So as you can see, as has been mentioned on this call, we continue to see a fairly low number of cases being reported in. As you can see in the tail end of the curve here. So good signs that we are continuing to move in the direction we want to move, right? So as you can see here, there were 39 cases reported on Navajo Nation in these last 7 days, which puts us at a rate of about 25. So this rate does put us in that yellow threshold, as has been mentioned. So COVID transmission is currently considered moderate per CDC guidelines. As you can see, we did change the coloring of this map to kind of be able to distinguish a little bit more what the rates were looking like. So as you can see, a majority of service areas are reporting rates below 50 cases. As you can see, areas such as Chinle, Fort Defiance, and Gallup are still well below the rate rate of 100, but they are kind of in the 50 to 99 rate. But again, we're seeing good signs. As you can see, percent positivity also continued to decrease. So percent positivity was at 3%. On average, there were 430 tests done on a daily basis. And our hospital capacity also remains stable. So hospital beds are at 52% occupancy and ICU beds at 69% occupancy. Looking at vaccination status, so among Navajo Nation residents, 66% have completed at least their primary series, and of these, 44% are also up to date, as you can see there. Looking at overall trends, we see again Navajo Nation cases are continuing to decline, and overall cases in the U.S. also remain fairly low, though it looks like it's also kind of at plateauing. So again, as you can see, most states are reporting fairly low rates, all rates below 200. Arizona did see a little bit of an increase, as you can see there, trending third, but their rate is still fairly manageable at 139. Navajo Nation is currently ranked at 26th in comparison to the other states and jurisdictions. As you can see here, again, just, you know, a visual representation of the rates. As you can see, most states are again reporting fairly low rates. As you can see, Arizona did kind of go up just a little bit, with it represented by that darker blue. Looking at it by county, we also continue to see progress here. So as you can see, the counties encompassing Navajo Nation remain at substantial community transmission or moderate, but we are seeing a lot more of the kind of surrounding counties go into that blue low community transmission. In terms of strain surveillance, so again, we continue to detect more Omicron cases here, as you can see. And this is, you know, aligning with what overall across the United States, you know, Omicron continues to dominate. We are beginning to see, you know, BA2 really become the predominant sublineage of Omicron, as you can see they're represented in the pink. In terms of our high-risk chapters, 4 chapters made it to the list this week. So again, we continue to improve on that end as well. So overall, cases continue to decrease. You know, rates continue to decrease, but still moderate COVID risk and transmission. Again, the Omicron variant has been detected on Navajo Nation. However, the BA2 variant has been detected in border towns of Navajo Nation, so not yet on Navajo Nation per se. Lab-based test positivity continues to decrease, and hospital capacity remains stable. So as you can see here, lab-based positivity and hospital bed capacity have met the green thresholds. The cases are still in that yellow threshold. So overall, we're still, you know, at level yellow, but again, you know, we are seeing great improvements across the board. So that concludes today's update, and I will go ahead and hand it back to Dr. Fowler, I believe. Thank you.
Thank you, Larissa. I appreciate the update. Kadoshi, bikiti tani tam hat hatnash na galesh kadosh na. Di washti يزلتا اي تبيت اتاتون لي تدينو الا يوت كاسنتا ايتا شي ايا تسجج ايان دهرنا اكل تسوي به كي شكيروش نه نخاكي نيتزندو كدو بهس اني دندلني بكهنوس اني ادو دين الكاي اتين دا الكا ادو زل ابنها انو اي قد نهز انقد ادو از بنبن اليا نخا تاليا او يو از نخا تاليا ايشين به كلاتو ين هكا نالو وقديد نبل خاطر بقى إدون هنا قو إشتدينو ما أخذ هاتزوني أي يبو يا أني أي بأيه نيزن أرو دي لهو إنت أو نلي أوميكرون بدي نني ABA2 نني أي قد جو أي أونزاج يا إثني كنت دو سامبتا تدنا كيفنا أرو دي high risk chapters دي نني أي باكا پروت أرو Coyote Canyon Ado Indian Wells ajo oyote ajo high risk ne ko ad ene finito ko din al kahit soigi bihi kre ado din da al kahon da al ene lab ne edo ejonna asset kit is il ibnas ana edo dot ejonna bihi kre ko ad ende dot is green ni gi bihi kre ko ad en ya at en na hotle jo ajo on yika أكون بكودي عن أجا إزال إم بتلاتينات أني ليني كابتن براين جونسون هيتنا هذا ديت آدم هيت إيسا بتخانز كتو إيدين الكاي أتي إزال إبتناز أنغو أجا أتي بتناز أن هيتنا آدو شدول نتان زنو دون تخطو أخوهوت إيغو إي أجا دكوسناز إيت أتابديت نيني أجا شينغتن نندت أولكا كنت إزاي لني بخزني أو يو نخاتاليا ابن ناتش إيجو يا أني دو يا أتزا كو إي يا هينزن دو كنت أتينا دو إدي دو كوس دو جو بالن دا ديش نخا إيشي بجليكي خني أنت دايله دا جو إي allergies نبلغانا كأتش جو إي ناسني هي أتي ناسني جو إيه هوت إيهودا نجيكيشله إيه إسنه أدو دي خيدي أدو دو نيلتن تهجو زيل إني أصفنه إني خادة نتتكونا ديسكيلو إيه كدو نهيل إشتا أنانا الإيرو جو نهيلنه أنا دين هيج أدون هنات أني يهول نأيكي زيل إنا غاجدو دي كلي لتسويكي بيه كيكي بني ناتي تا أتان دو دي نا أجو شكو آدو دين تا إنيكو أي لتسوكو نأنال كت أكو دي خاشين تكو دي temperature check لني أي دو قدنها ودنه ko Asian hippe ta akon yang khathanes ke gosh on echo gaslo sto jo an hippa akon nasen ado di flea market at hasna ado di ethazest gym do wellness it's is ba akhan aj slash you gon da atin on la 25% asa peso kishi big awal khain na kiya jo ta an dal ne Aro di ho waje istaje in khayat echon hitne akonde ayis ohon ne asintadon hitadon nitle entaka jo ho waje a be ta huilia ado di nahangado eslanta atlehiki as cuido sani da hashine la tahalla ajdo tahadne ta taholla jo aj natido ashla do yago anal kitchen tsena anes najit how that ne ashla ata ta hatina dino ashla do yago ya o de haida da band ilda chiyan shlatin do yago behas arodich achde bigi atlanta atlet asad ne zantin chde job khonde deneni dini o yuch de bi khati pinlas do ishin ka beta na huyada Ado dini ka achinen dini ni token hinalike da danle ado ni zahido da hollong jo khashine na ultran lini etso de legend na hol jisto da iltraje Jode aje prefer nini di anchabi na kidid yese be na a condition ultra nas anjelo ultra nas ani lini aje ye bohodni upon the moderate isne at o the cost o the Jokoshi aya at jo aj di asla apeso belta tanya jo 75% isne ot in kaba ko no sendole jo ultra olye jo aj ya aj do not ani da halong shin khashit aj yin da ado ha command operations center aj do guidelines ikho da any do aj ko lo okonde ultra no sini do na ka ota ultra ido na tani no sini na ka achene la betra mes ke go da ashon da ho wade sedaj ko na khaya at jo dan hilne hina tani ara kodon hina tani ya hodne the fair da banda il de han shi honne neta ado etrahata ine kitrahata ine da dolie jo besinda wido no bayat ki okonde like at el nido alle chmotal ini sato o tion winilsen no behes ani hata del net jo kodo chicha and lini ye his ishta anayos sendole Bantol tahishe bantol tande jodi khit adi nasnihi bit atine baho arodi dat on de shnini gido at khazes aj andar ne ako aro ben hehat osi chik edo shidne alet adi denen lini juno ahon ze bahadal yado nasnihi juno yedashnish jo ni hilato da endo ba ni zen kolon hinat ani inini ita khalas sogi bihi khe shin til zendo til yendo ni hitode zenda dis ai ben nach he a koho de so dago edi ash and we no sinchik edos ne ado di filters da do ye ado fish chita chaka shin a ho wat is dage ho wat gebe ho ni ho jo ho jossen olje shin kodo ben hit na da fil net dole ado di based on linin hit des anido kodo o you ba na adol kit jo ati beso atas net dan hisne aro at rashine la osa nahaj je jo konde shin kodo ben nada anish ata inisho oteshik edoshne do hajoshin obech khainosne ado besta behane o datit atato noda satashina nishko eto satashin sajit nahal na at ako edo na khapa ko no sendon hizado hajoba ata hosia ado ana ndleti besh behane bechi atas ki eto ado ana ndleti bechi atas enne the ARPA hardship drive di nini AD at the modo digitidon ta initial na enle belti ta senel da the shin de credole. We will have our ARPA hardship drive in Albuquerque this Thursday and Friday, April 7 and 8, and we will open the doors from 9 a.m. to 4 p.m. Asian Adin de credole 80 peso. Nihitrapo or kahido nihitine CIP da. But better than nature not so see other not de tletole. Not stay go adol need adol did chitant el castode. Be das nelle sippy holye aj sippy de shin de credole ko ad ad the appen se KCB in de ko ad shin kuni tlonole. Akon de in hinge kedi 18 hinchidon he said Bedata des bale ati aben dako at the nebel hot of a kai. Shin on the hapa on the sendole. O quande lake origin jaga and nido yen da kreda. Ain't his bahazen. Ajabanat ani atalate the holla. Ne eta seta na aj. Nihie ati ishta ati beneta. Benina ati nini shik edoshidne. Nakhaha nitzen. Osh yo o ik at the hajit ino ajito da noda. Koja wheel on to qua abe not nitien. Akon here at the abeneta. Yisitot is be art and that dot is be the kagoshin that now that it need. Akon de dik as it sogi silkit asla Nana sacha eto is Asian Kodona Haba Sindole. A Kohon Sabo Kodona Hatna Wishnet Ole do the kitty Tani it do yat ane hata so gizido. Juno Kodon hit nahas net hinat ani don he is a in a danlini. Aj etalate not ani danlini ko. Ihe bedi nidole ara ala lange de osnishido ade hata so gizin hido da hasiashik edo shidne but the bear dat Nihinan Nishnat it Nihi Otkat dat it Ha Ishi Os Inni Ho what the Beck in Dotahi Hajo Adas Ado Sadiat Ehibe Chi Adas Hitchik Edo Shidne Yo on ne Haladi Ato Ati Honji Kishi Binna Ati Hota Hitine Ashi Inido At Ene da East Dante Jobe Hilda Hosne. But ya is his not the hosnet that don't know that he must son in his shade. A job able to hosnet, but the hosnet. His ad linibin the house after Hala Yin. Ado a death need of its sketch, Edo shouldn't. A once a she, Nahana the Iliad or Leto, not the more do not kiss Kane, she. Another of his Asian clown, his not the hotine. Ko he had she Edo shouldn't, da the house, yeah. A gone